Done.
Om Dhanvantaraye Namaha. A warm welcome to everyone. So today it's a 52nd webinar from the RAAUOS team, and the topic being SINDURA KALPANA and its clinical utility by the Rasa Shastra expert, our own Dr. Sathish Ranjanagi sir. So before we could start the session, I would request Dr. Vishwanath sir to uh, uh, start the session with the divine prayer. Thank you. Over to you, Vishwanath sir.
Thank you, madam. Namaste, Vaidyas. Welcome to our webinar. So before going ahead, we'll offer our prayers to Lord Ganesha and Lord Dhanvantari. Om Ganana Ganapativam Havamahe Kavim Kavinam Vamashravastamam Jeshtarajam Brahmanam Brahmanaspada Shunvanno Devasida Sadhanam Mahaganapataye Namaha Prano Devi Saraswati Vaje Virvajini Dhinama Vitriyavatu Ano Divo Brihata Parvatada Saraswati Yajatagantu Yagnam Om Namami Dhanvantarim Adidevam Surasurairvanditapadapadmam Loke Jara Bhayar Mrityunashanam Dhataramisham Vividaushadhinam Dhanvantarim Ramanatham Sarvaroganivarakam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Samasta Sanmangalani Bhavantu Om Shanti Shanti Shanti. Thank you.
Thank you, Vishwanath sir, for the divine start. So before we could start the actual session, I would request Dr. Dilip sir to give a brief introduction about our RAAUOS team and what are the services we are up to. Over to you, Dr. Dilip sir.
Namaste everyone. So we'll give you a brief introduction about RAAS. So what is RAAS means? So RAAS is Rudra Arbuda Ayurveda approach under one shelter. So this organization started
Dilip
the
sir.
name of RAAS organization. In RAAS, we are conducting 3 webinars. 52nd webinar we are conducting. So the RAAS has started in 2019. So we are celebrating 60th year now. We are conducting monthly webinars. So and we are conducting weekly classes. So 2 days in a week we are conducting classes, one in Monday and one in Thursday. Every Monday we are conducting on one yoga. So any formulation, any Ayurveda formulation, now it is going with the Yamagarbha portal is going on. And every Thursday we'll conduct one cancer discussion. So now breast cancer is going on. So we are conducting Ayur Yatra. So we'll go to the experts, we'll learn from the experts. We had been to Hyderabad, we had been to Pune. So now we are going to Gujarat from 20th of this month. So we're meeting cancer experts and we are learning from them. So this is the intention of Ayur Yatra. So we're organizing Ayur Yatra every 3 months and 6 months once. And we are organizing cancer screening camps. So till now we have organized more than 50 cancer screening camps and more than 10,000 people get an advantage of this. And we are conducting public awareness programs. So it has started from last month. So we will take one common issue that will going to cause a cancer, not only cancer. So any public related issues. Last month it was started and now it is spread to all the states also. We are conducting in their native languages. So last month Dr. Archana madam did the webinar on Malahdata and constipation. So this series is continuing every month, one public awareness program. So this is about a brief introduction about us, and we have registered trust, registered NGO organization. So we have a separate account for the LAS, and we have started membership program from January. We'll launch membership drive from January. It's a lifetime membership we will give to all the members. They can access to our recorded videos. They can enjoy all the classes on any time. Okay. So this is about brief introduction about RAS. So our founder is Dr. Shakuntala Patil Madam, and we have a team. We not only Dr. Shakuntala Patil, Dr. Amulya, Dr. Dilip, everybody, Dr. Geeta Patu, everybody is working on the motto. So cancer cure and we need to relieve from the cancer. Okay, so we have a good admins team. More than 20 people are working in administration work. Okay, thank you, Nana. Again, I welcome to Dr. Satish Ranjanagi sir for the webinar, 52nd webinar. So thank you.
Thank you, Doctor.
Thank you so much, Dilip sir, for briefing out about our RAAUOS team. So before starting with the actual session, so today we have Dr. Satish Ranjanagi sir. You're already familiar. He's a Rasashastra expert. So I would request Dr. Geeta Pattur madam to give a brief introduction about our eminent speaker for today. Over to you, Geeta Pattur madam.
Thank you, Dr. Amulya. It's my privilege to introduce today's speaker, Dr. Satish Ranjanagi sir. Recently, we have met him, and we have heard his excellent discussion about the special cases and all. Really, it will be very helpful for everyone. And sir has completed UG in 2008 from Rajiv Gandhi University of Health Sciences, followed by MD in Rasashastra and Bhaishajya Kalpana. Sir is founder, doctor at RAAUOS Ayurveda and Yoga Chikisalaya, Dodballapura, Bangalore region, and founder RAAUOS Ayurveda Hyderabad. Sir is senior consultant at various hospitals and clinics such as Ayur Central, Dodballapura, Shreyas Retreat, Nelmangala, Foster Multi-Speciality Clinic, HLC Ayurveda Hospital, Electronic City, Kshema Multi-Speciality Hospital. Sir has completed 17 years of clinical experience in Ayurveda consultations, Panchakarma, drug designing, research in molecular biology. Sir has long-term tenure of 10 years at Saukya International Holistic Health Center, handling multiple projects including NABH accreditation and projects under the National Medicinal Plants Board, NMPB, for Karnataka government. Swasthya Ayush Integrated Medical Sciences, Hyderabad, Swantana Integrated Center, Hyderabad. Sir has special interest in challenging areas like cancer, autoimmune conditions, and GI and hepatic, metabolic syndromes, subfertility or fertility, neurological and neuromuscular ailments. Thank you, sir. Welcome to our RAAUOS webinar, sir.
Thank you, Doctor. Thank you.
Thank you, Geeta Pattur madam. Now, sir, we are all ears to listen your talk. So,
yeah, thank you, Doctor. Thanks for the warm welcome and introduction.
So, over to you, sir.
Yeah, thank you, Doctor. So, good afternoon, everyone. So, without wasting a time, I'm going to start with my topic. Today is SINDURA Kalpana and its utility. So here, I'm not going to discuss much about what is explained in the textbook and all those things. Like, Falashruti of each SINDURA, I'm not going to explain because everyone will be easily accessible. I'm going to more focus on gunas of SINDURA Kalpana, and with that background, how I used in my clinical utility, what is my clinical application of those particular Sindhuras in different diseases, I am going to put in front of you. And there will be a combination and multi-combination of many drugs. For example, with a Sindhura, what I mix in, what are the other drugs I am going to mix to get the benefit. That kind of approach I'm going to explain to you. Dr. Nankumar, next slide, please. Yeah. So what is the main characters of SINDURA? How it is clinically it needs to be interpreted. With all these things, I took a background. My studies background is Rasaratna Samuchaya, Rasayoga Sagar Sangraha, then particularly Rasaniranawa, Rasatantra Sara Sangraha, Siddha Yoga Sangraha, Basavarajyam. With all these group of books, I collected the data, and those falashrutis I mix each other, and I'm using it. Once again, I'm referring the references book is Rasatna Samuchaya, Rasarnava, Rasayoga Sara Sangraha, Rasatantra Sara Sangraha, Siddha Yoga Sangraha, Basavarajyam. These are the books what I refer normally for the Sindura Kalpana, and I'm putting this topic and my clinical approaches I'm going to narrate now. So, and mostly this presentation will be based on the gunas of Sindura. So now, what is in general, all the Sindura, what are the characters it possesses? All Sinduras are Laguguna. That is how it, except one or two Sindura, you will get all the Sinduras in the Kantha Pradesha. So, Kantha Pradesha. Then it is also having a high penetrating activity that is due to the complete usage of Agni Sanikarsha, because there are certain drugs like Rasa Sindura, Shadguna Jarita, and also certain Tamra Sindura and all those things we are making 6 to 7 Jarana. So due to those Agni Sanikarshatva, that particularly becomes literally the penetrating action in the cells or tissues, it will become very high. And all Sindura possesses Rasayana Guna due to the Gandhaka Jarana. I don't need to explain much about Rasayana property because of the Gandhaka Jarana. How much you keep doing the Jarana for the Gandhaka, so Gandhaka Jarana you do, the Rasayana property will keep acquiring. Next slide, please, doctor. Now, what are the name of the Sindhura? So we are going to discuss about Purna Chandrodaya Rasa, Rasa Sindhura, Malla Sindhura, Tala Sindhura, Shila Sindhura, Suvarnavanga, Samira Pannaga, Ashtamurti Rasayana, and Vadhyarana Rasa. These are the things we are going to discuss today. Next slide, please. Okay. So now let me start with the Purna Chandrodaya Rasa. So Purna Chandrodaya Rasa, and also it has been called as Siddhamakara Dvaja, and there is some minor difference between the preparation. After the Siddhamakara Dvaja has been prepared, many people mix Pravara Pishti, then Mukta Pishti like that, but Siddhamakara Dvaja alone, what I'm going to talk now. So it is Rutpaustika, Vajikarana, Rasayana. Especially the Rasayana property, how one need to consider is according to my practice I am sharing with you. Always I take it in autoimmune, all the autoimmune condition for the Rasayana purpose. Once you do the Deha Shuddhi, or particularly once the Vedic Shamatva is being done in the autoimmune condition, for example, you treat once the symptoms are reduced, all autoimmune condition, irrespective of anything, Siddhamakara Dvaja can be a drug of choice in all autoimmune condition. So that's where the Rasayana word comes for the Purna Chandrodaya Rasa. It is Balya. In which condition I'm keep using this drug as a Balya? All post-infectious any condition. For example, you take the tuberculosis, you take any bacterial infection, viral infection, the post-viral cadre, the whatever diseases comes. So this can be a Purna Chandrodaya is one of the main drug. You can use it as a Balya. And you will see the visible changes within the the 48 hours to 72 hours, you will see the difference. So it acts as a Rakta Prasadaka, and it is having a Yogavahi and Ojo Vardaka. These are the property I am considering in my presentation. How Ojo Vardaka? Because of the Ojo Vardaka, the quality of Ojo Vardana, it can be used in all cancer condition, all Raja Ekshma condition. So these are the simple one each gunas of or one particular characters of the Sindura, Purna Chandrodaya Rasa. You can use it in a clinical utility. So few of the example. As a Rasayana, what I do? Along with the Purna Chandrodaya Rasa, I mix Abraka Sahasraputi and with the Rasayana Churna. It is one of the, it becomes like a really good Rasayanartha. My combination, I am repeating, the Purna Chandrodaya, Abraka Sahasraputi and Rasayana Churna. This combination I use it as a Rasayana in all autoimmune condition. For the follow-up, my patients will be undergoing this combination. As a Balya, I mix Purna Chandrodaya, Loha Basma or Suvarna Makshika Basma based on the patient condition. And again, I may take Rasayana Churna or I may choose to give it a Rasa Sindura. So this is as a Balya when I'm going to give the patient. So this is, see, the also apart from Suvarna Makshika and Loha, one more drug of choice is you can also mix as a Balya. Here Tamra Basma or Vaikaranta Basma also can come, but most of the times as a Balya, Loha or Suvarna Makshika will be the drug of choice. So in case of especially particularly the patients with a single vessel disease, with having a lot of dyspnea, single vessel disease or triple vessel disease, where there is a blocks in the heart, when they have a exertional dyspnea, their combinations are Purna Chandrodaya, Tamra Basma, Tamra Sindura, Tala Sindura, and Pushkara Mula Churna. This is a combination in all multiple block, single block diseases. My patient will be on this particular combination. So this is in nutshell about Purna Chandrodaya Rasa. So as I told, always I try to give the up to half rati to 1 rati. Even in certain cases in emergency condition, I give loaded dose of up to 3 rati also. I give in a single shot. That is how it works. And also the few of the combination you can keep seeing. So the 125 mg of PC stands for Purna Chandrodaya, and Nagarjunabra in hypertension you can give. Then Purna Chandrodaya, Pravala Pisti Jatamanse combination can be given in palpitation due to the anxiety, and also it is one of the main combination in tachycardia or the particularly ventricular tachycardia, what we call. This drugs works like miracle. Next slide, please, Doctor. Yeah, so that's in nutshell about Purna Chandrodaya Rasa. Let me go to the now Rasa Sindura, the most widely used among the all Sinduras, Rasa Sindura. Shadguna Jarita are one single also. So this is the Rasa Sindura. As whenever I go through the Rasa Sindura chapter, how much ever I read, it is really keeps giving lot of information. And not only that, with the different scholars, when I discuss about Rasa Sindura, there are people who just practices on Rasa Sindura. Now let me go. When I adopted my practice with the Rasa Sindura, I found it is like act like a catalyst. It is very wrong to say catalyst, but see, you Yoga Vahiguna, you mix Rasa Sindura with something, automatically that particular drug delivery becomes high, the absorption assimilation will increase, and also the particular delivery of the medication to the target cell will be done by the Rasa Sindura. Also, Rasa Sindura is that itself act as one of the major medicine also. The main benefit of the Rasa Sindura in my cupboards is on respiratory disorders, because of it is the Uttejaka Guna. The Uttejaka Guna, it helps in respiratory disorder, especially whenever you need to, there is a underlying sputum is there, which is really hard to remove it. So it has really become thick, like the bead form sputum. So you just mix with the Kafasravi Aushada, like Shrungabhasma, then automatically in the Sanchita Kapha, Rasa Sindura and Shrunga Basma is the combination where you can mix and give. Then The next is it act like a Vishagna, and it act like a Vishagna as well as Kafagna. So this combination, the sputum, you go for a sputum test, there is an underlying lot of bacterial and bacterial infections are there, and also patient heading towards the pleurisy. Then combinations are Rasasindura, Arogyavardhini, Shrungabhasma, and Lagumalini Basanta. So this combination, if you mix, then automatically the specifically bacterial infection will come down a lot. And even you can literally see, you can do the sputum culture and you can see the difference within 14 days. Means in a chronic infection, I'm telling you, especially bedridden patient, specifically when they are not in a good respiratory strength, they try and because of the compromised immunity, they will be going for a continuous infection with a sputum and all. So, and also the Rasasindura is being explained by the Acharya, Keetanujanya Kshaya. So in that particular condition, always I noticed Abraka, Swarna and Rasasindura. This combination work like a miracle, and specifically because of the continuous infection, when there is a patient getting emaciated, and when you see some sort of Kshaya Lakshanas in the patient, then Abraka, Swarna and Rasasindura is the major drug of choice. Then in Urakshata patient, when patient spits the yellowish sputum with a foul smell, like the rotten egg smell when they are throwing away. So there, combination of Rasasindura, Arogyavardhini, Shrungabhasma is one thing. And also if you find the traces of blood in the sputum, then you should mix Vasavaleha and Rasasindura. This combination specifically chest related, all the sputum conditions, it is better. In certain condition like dry cough, when there is a lot of dry cough, completely Vataja, then you should be very, very, very careful in using Rasasindura, and especially chronic condition, Shadguna can be used, but still you need to be mixing with some amount of some kind of a fatty substance like ghee or cream or something you have to mix, but one need to be very careful when you use Rasasindura in a dry cough. Initial stages, dry cough can go up in the dry cough condition, the cough reflex may go up due to the Rasasindura. That's my clinical observation. There is no particular the supporting document for that. Then next, the Rasasindura act as a Hridaya Balakara, Raktabhisarana, Uttejana, Snayu Sadruda, and also it can be used in Vishtabda Jirna and Amajirna. So these condition, especially Amajirna condition, I used Rasasindura. So this is the main clinical utility, and specifically when it comes, it can be used in Kafadosha, Rasa and Raktadhatu Gata Vikara, Masadhatu Vikara, then Shwasa Vikara, Hridaya Vikara, and Amashaya. These are the normally where I use. So in overall, all Pranavayu Srotas and Annava Srotas Vikaras, definitely it can be utilized. And particularly the Kafasthana, the Vishesha Sthana for the Rasasindura is Kafasthana, and also it act on the Grahani. So, Doctor, next slide. Dr. Nandakumar, next slide, please. Yeah, thank you. So next, I'm moving on to the Malasindura. Particularly the dosages are half rati to 1/4 rati to half rati, but in my experience up to 2 rati in a day, I'm given. Even a single dose of 250 mg also I given in many cases where there is a emergencies. And usages are like Shwasa, Kasa, Sanipata, Unmada, Apatantraka, Amvata, Vishuchika, and Vataroga, and Prameha. So I use it in Prameha a lot. This Malasindura, I'm getting good results. So whichever guna I captured, I clinically utilized in my clinic. So that's how I'm explaining. And definitely Malasindura is Tikshna and Ugravirya. So Malasindura, when we use a lot, and specifically few people will land up in epistaxis. So that you have to be careful. And where there is a Pitta Pradhanyata is there, or Pitta Pradhan is there, but it has been in the Lupta state. So Malla Sindura will open it up. So in my clinical practice, till the date, about 2 to 3 people who landed up with me epistaxis, there we reduced the dosages. I never stopped the medication of Malla Sindura. I reduced the dosages. So now, what are the main clinical utility? It is on the lungs, then Vatavahi nadis, and it is Hridaya Uttejaka. And useful in Kapha Vruddhi dosha, Ama Vruddhi doshas, and Vata Prakopa. See, this is one of the major drug in both Vata and Kapha Pradhana, all Vyadhis. As everyone know, Vata and Kapha is itself is both are opposite characters each other. But this is Vata Kapha Hara. So according to me, everyone should have in their own cupboard this Malla Sindura, because this will give you lot of benefit in treating Vata Kapha Pradhana Vyadhis. So as simple as diabetes. Diabetes is also Vata Kapha Pradhana. So when there is a blood sugars are very stubborn, the Malla Sindura act like a miracle. So especially one clinical utility I will tell you, then I will move on to the major implication. Specifically, I keep using bedridden patient. When there is a bedridden patient and there is always pigeon sounds from their throat. Because of the throatal secretion, they need to keep using the suction machine, and they need to keep clearing the throatal secretion. There, give a low dose of Malla Sindura with honey, just rub it on the tongue. The throatal secretion will reduce a lot. Because as soon as there is a throatal secretion in the bedridden patient, there is always aspirating pneumonia is one of the condition. What is the risk? So this Malla Sindura is nectar for them. So in chronic paralysis cases, always I keep using Malla, Kuchala, and Ashwagandha is my drug of choice in chronic paralysis cases. Not only, see, when I say chronic paralysis, it is not about only the the paralysis or parapheresis. Even like a lot of neurological debilitating cases where they present, for example, due to the LS spine stenosis, when they present a paralytic leg, even Malla Sindura is a drug of choice. With the thoracic vertebrae issues, when they develop a paralytic leg, you can use it. Then also where there is particularly the ankle go for a foot drop, even Malla Sindura is a drug of choice. So one of the major combination what you get easily in the market, specifically the Kanjani Karirasa can be used, but when you mix Malla Sindura, Kuchala, and Ashwagandha, it really acts like a wonder. So even that is what I was explaining you in the children. When there is a lot of congestion in the chest, the sputum collection is there. In kids also, Malla Sindura from the 15 mg or 20 mg, even up to the 60 mg, easily can give this, even in the children's also. Now, in Pitta Pradhana disorders, one has to be very, very careful. So another my clinical observation with Malla Sindura, Malla Sindura specifically in genitourinary cancer, I keep using Malla Sindura and Rasakarpura specifically in Upadavsha, Kusta, Firanga, cancer condition and inflammatory condition. It can be used, and especially when there is a rheumatoid arthritis at the peak, when the symptoms are very, very high. So the Malla Sindura and Rasakarpura is the combination where really it acts like a wonder. Then the Malla Sindura is that itself is act as a kapha samshoshaka. So means it helps in drying up the sputum where there is a lot of secretion. For example, due to the allergic rhinitis, when the people keep forming the mucus, Malla Sindura is a drug of choice. Chronic sinusitis, then the trochobronchitis, the kapha, where you need to reduce the secretions of mucus, you can choose Malla Sindura. Then in the both URTI, LRTI, the Malla Sindura can be used. And other areas of usages, particularly in the certain, specifically my in my clinical aspect, I used in a gram-negative bacteria, where there is a gram-negative bacteria. When it is not responded to any varieties of antibiotic, there is a chronic ongoing infection is keep repeating. All gram-negative bacteria, Malla Sindura, not less than 50 cases. I have the culture report. It responded very well, all gram-negative bacteria. And apart from that, the inflammatory arthritis, then disease management also, Malla Sindura can be used. So as I told, everyone knows it. I am just repeating. One has to be very careful in usage of Malla Sindura in the Pittagata disorders and Pitta Prakriti person. Next slide. Okay. Tala Sindura. So matra up to 1 to 2 rati. In certain cases, I go in a day up to 750 mg to 1 gram also I given in certain cases. I never came across any complication till the date with the Tala Sindura. Everyone knows the rasa. It is katu rasa and kashaya, vipaka katu. Then it is snigdha, kushtagna, kafagna, kandugna, and rasayana. So used in kushta, vata, rakta, upadamsha, and rakta vikara. So now, in the particularly the guna variety, when it comes as a rasayana, in most of the cancer condition where there is if the patient is unaffordable, if I cannot use the hema or swarna basma when I am not using, tala is the immediate choice for me in specifically conditions of cancer. I am telling you, definitely it is not alternative or it is not the choice of drug instead of gold, but still Tala Sindura in the places of gold in certain cases we used, and we got fair amount of success in cancer condition where I am using Tala. So then what are the doctor, go back to the previous slide only, doctor. Thank you. So this in the Twacha Vikara, and so the mainly Twacha Vikara, Shwasa, Kasa, I keep using it. It is act as a Kafagna and Kandugna. Because of that, all the specifically the all Kafa Pradhana Kushta varieties it can be used. Then it is also Kafagna and Krimigna. With this combination, I keep treating Kapha and its related pathologies. And as I told, wherever Malla Sindura is a bit hard on the patient, you can go to the Tala. Then it is also Joragna, Krimigna, and Kafagna. With these three combination, any Shitanga Sanipata and Parivartita Joras, when there is a relapsing fever, then definitely you can use it. Tala Sindura is a drug of choice. Next. So it is Yakrit Balya and Rut Balya. So with this particular two gunas, the conditions of edema develop due to the liver and heart. So this Tala Sindura is a drug of choice. As everyone knows, because of this Tala is one of the Pashana. It act like it helps in improving the blood circulation, Raktabhisarana, and also it helps in lymph circulation. Due to that, the edematous condition, especially related to the liver as well as heart, can be well treated with this medication. In certain conditions, like kidney conditions like proteinuria, albuminuria, in around 10 to 15 cases, I used it. I never came across any complication till the date, but the dosages were restricted to 30 to 60 mg. Along with that, other medications, definitely corticosteroids were mixed. But in proteinuria, nephrotic syndrome, albuminuria, high microalbuminuria, I used Tala Sindura, and I never, till the date, all the patients are stable. I never came across any problem with urea or creatinine or uric acid till the date. So next, let's move on to the Shila Sindura. So Manashila, up to 1 to 2 rati we can use, and also the users, the Shwasa, Kasa, Meda, Kushta, Visarpa, Kandamala, and Rakta Vikara. So now, before I would start, I will tell you my clinical experience where I use a lot of Shila Sindura. There are two conditions without any hesitation. I keep using Shila Sindura. One is adenoids, tonsils, and particularly the elderly people constipation. This is where I keep using this the Shila Sindura a lot, especially the adenoids. When there is the adenoids in the throat, adenoids in the nasopharynx, because of that the kids keep getting repeated upper respiratory tract infection, and certain people lower respiratory tract infections like both bronchi, wheezing, all these things. Shila Sindura is a drug of choice where to treat adenoids. In the nasopharynx, treating nasopharynx adenoids, Shila Sindura, when we use, around 50% of the success we get it. But whereas specifically when you use in the throat related adenoids, you get almost 70 to 80% success rate. But always the nasopharynx adenoid treating is a risk factor, and there is a 50% success. But Shila Sindura, it clinically, and also we have X-ray reports and all those things. Visibly, it can reduce your tonsil size, the adenoid size, this thing. So that's how it become a choice in a lot of the pediatric practice. This Shila Sindura can be used in the pediatric practice. When it comes to a elderly constipation, when there is you do the colonoscopy. The colonoscopy is a clean sheet. There is no problem at all. But still, there is unexplainable chronic constipation is going on. So it shows there is a rasa or reduced antrashakti. So there, Shila is the main drug of choice. You can always add on this particular Shila Sindura. So the elderly constipation will be treated very well. Of course, you need to mix some other combination as well. So, but main drug of choice is Shila. So, what are the qualities of Shila? Guru, Varna, Saraka, Ushna, Lekhana, Katuvipaka, and Tikshna. Then also it is used in Visha, Shwasa, Khasa, Bhutabada, and Raktavikara. So, mainly this is having a Lekhana and Kafagna property. Due to that, so in all atherosclerotic and bronchiectasis and bronchial ectasis, this become a drug of choice. Due to the Lekhana, Katu, and Kafagna, so it helps in reducing the Meda, and it also helps in to reduce particularly the Kapha and Ama in the particularly the Srotas. So due to that, especially in chronic COPD, chronic asthma cases, the Shila is the major choice where there is a lot of secretion in this thing. So even in the honeycombing appearance, bronchial ectasis and bronchiectasis. So Shila Sindura is a major drug of choice, and also it is Ojo Vardaka. Because of that, it will prevent the Kshaya at the chest level. So it is also, as I told, Apache, Kantamala, and Kapha Pradhana Kushta. It can be used without any hesitation. And because of the Uttejaka and the Jantugna and the Sarasnigdha, it becomes in the all Amasha and intestinal issues. It helps in cleansing the areas. Okay, so again, because of the Uttejaka Krimigna Guna, so as I was telling you, so it helps in relieving the long-standing intestinal infection. Okay, for example, I'll tell you, there is a certain people due to the large intestine size is the lengthwise it is bigger, and there is a lot of curves. Because of that, the stool get adhered, and they keep developing a lot of gas and the constipation. There, Shila Sindura is a drug of choice. It really helps in improving the intestinal motility, and also because of the continuous stool adherence, what they develop different bacterial growth. The Shila Sindura will help you to treat that. The next, okay. Suvarnavanga. Now we are working at the Suvarnavanga in a lot more ways. But again, now when it comes to Suvarnavanga at the clinical utility, in my practice, up to 2 to 3 Ratti I use. Then mainly as a Balya, Prameha, Pradara. In Pradara diseases I use and as also used in Madhumeha, Agnibala, Dhatu Kshinata. So especially when there is a lot of sputum is adhered in the pediatric cases and specifically adulthood, just mix with some kshara and honey with the Suvarnavanga. It helps in the sputum start to release very quickly in all Mutra Krucha condition. Then specifically, so especially in the Jirna Kasa and Shwasa, when there is a lot of Kshaya Lakshanas, you can mix with the butter and you can use. Then in the Jirna Puyame cases, STDs, then all Mutragata related, you can use it. And especially in the Shweta Pradara, I use this condition in chronic leukorrhea cases where there is a curdy discharge with a foul smell and all those things, and very chronic, like the 6 month, 1 year, 2 year, when they come. The combination are Suvarnavanga, Suvarnamakshika Basma, and Godanti. This is one of the ultimate combination what I found. I keep giving with other kashayas and all those things based on their condition. But this is the base drug, Suvarnavanga, Suvarnamakshika Basma, and Godanti. This combination really helps to clear the leukorrhea. And also all the symptoms related with tiredness, the generalized body pain, everything will be treated by that. So normally the Suvarnavanga also, we use the Suvarnavanga Kshara we are trying to prepare. But we prepared once and we use in Uttara Basti, specifically in adenocarcinoma cases of the bladder. We use in along with the Kshara Taila or some combinations, even the decoctions like Varana Kanchana Kwata we make and we mix with this Suvarnavanga Kshara, and we keep pushing it in the urinary bladder, especially particularly the anterior wall and the posterior wall adenocarcinomas are well treated with the Suvarnavanga Kshara. And also in the Charmakila, means the multiple, when the patients present with multiple Charmakila, so Suvarnavanga and any Kshara you mix and you can keep giving internally very long-standing days. So also you will find a major difference in development of Charmakila all over body, especially around the neck when where there is a due to the viral infection or due to the metabolic syndrome, especially with the diabetic people when they develop a lot of warts. So this is a Suvarnavanga as well as Kshara combination is the drug of choice. Doctor, next slide, please. Okay, so now the most discussed Samirapanaga Rasa. The combination of Samirapanaga, what we use the combination, it is equal quantity of Shuddha Parada and Gandhaka, Malla, Tala, Shila. These all mix in a equal quantity, and Tulsi Rasa Bhavana and one more Kumari Iswara Rasa Bhavana. With that, what we prepared Samirapanaga, because Samirapanaga Rasa, there is a lot of explanation about the different preparations are there. But what I prepare Samirapanaga with these combination, that's what I'm going to explain. That's how I told the ingredient. So Matra half to 2 Rati, even in certain cases I go up to the 4 Ratis as well. So Guna, it is Katurasa Katavipaka, Tikshna Virya, and it is also Uttejaka, Bala, Kafagna, Kafavatagna, Kafavata Dosha. So again, so after Malla Sindura, so the Samirapanaga Rasa is a one more drug where it acts on the both Kapha and Vata. So it acts on the Rasadhatu, Raktadhatu and Masadhatu. So in all Amashagata Rogas, Yakrit Pliha Rogas, central nervous system, then the lungs, particularly Pranavasrutas, it can be used. We use it in lot in pneumonia cases. Kasa Shwasa, where mixed presentation are there. Because of the presence of Malla, Tala, Shila, in the mixed presentation of Kasa, Shwasa, it can be used, and it also helps in reducing the Kaphasrava from the lungs and the mucosal membranes of the respiratory tract. So, and also it helps in doing Kaphasthana Shuddhi. Definitely this, wherever you have some doubt or you are not comfortable to give like Malla alone, Shila alone or Tala alone, if you have a difficulty, without any hesitation, wherever you need to do the Kaphasthana Shuddhi, for example, in the Amashaya or specifically in the lungs, when the people are keep throwing out the purulent sputum, so there Samirapanagarasa is the drug of choice, especially in the bronchial ectasis cases where there is a higher amount of sputum keep producing with a purulent rotten egg smell. The Samirapanaga is another drug where you can give it to the patient. So, and especially Suvarna the Samirapanaga rasa you mix with the Suvarna and atypical Guillain-Barré syndrome in an emergency condition. Suvarna Samirapanaga is a drug of choice, and Suvarna Samirapanaga rasa is also a drug of choice in freshly diagnosed paralytic cases, especially with the infarct origin. You can give, and especially in atypical GB, I found a lot of benefit by using Samirapanaga with Suvarna Basma mixture. So that's in nutshell about then also it helps in kapha, as I was mentioning, and also just as a gist, Mala Sindura act as a particularly the kapha shoshana, but whereas it Samirapanaga helps in particularly the other way around, it reduces the kapha stravi, but whereas Mala Sindura helps in kapha shoshana directly, and also one more drug is there, Panchasuta Rasa. I haven't explained, but I'm just telling you. So Panchasuta Rasa, if you have in your cupboard, especially it acts as a very excellently on the Durgandhara. Durgandhara in the sense when especially as I was explaining regarding particularly the sputum related issues with a different purulent smell. So there Panchasuta Rasa really helps in treating Durgandhara. So it acts on both gram positive and gram negative bacteria, both Panchasuta Rasa. So in specifically when it comes with a vomiting, loose motion, with a vasovagal attack, when a person is completely with an infectious condition, there is a ongoing vomiting, loose motion, and all those things. In that particular condition where there is a vasovagal shock and with a sweat, just Samirapanaga, Mandura Basma, Suvarnamakshika Basma, and Pravala Pishti, you mix these four with a Tulsi Arka and honey. You keep giving like the just 2 to 3 pinch continuously, maybe more what we say. If you keep giving immediately, patient will come back from the vasovagal attack, and we saw a lot of cases like that, and especially everyone knows about Malla Pushpa. So the Malla Pushpa is a drug of choice in all hypotension related, where you need to uplift the blood pressure. If you don't have a Malla Pushpa, definitely so the specifically Malla Pushpa, Malla Sindura and Suvarna Samirapana combination act like a wonder. So this is one of the, again, one more combination. So in even vasovagal attack also you can use this Suvarna Samirapanaga rasa. So the Ashtamurti Rasayana. So the basically Ashtamurti Rasayana up to easily you can go with the 1 to 2 ratis. So Ashtamurti Rasayana, this is Rasatantra Sara Sangra reference, okay. Then this particularly the Ashtamurti Rasayana I use in my clinical practice with a patient deformity with neuropathy and muscle related atrophic changes when they come, specifically with a disc disease or muscular dystrophy cases. The Ashtamurti Rasayana is a drug of choice. Ashtamurti Rasayana, Loha Basma, Vishatinduka in all disc related issues. Ashtamurti Rasayana, Rajata Basma and Brahmi, specifically in Unmada presentation. Unmada presentation, it need not to be every time psychiatric disorder, even in the certain epileptic condition also we use. And elderly people with means with Parkinson with neuropsychiatric disorders, what we call neuropsychiatric condition, Ashtamurti Rasayana is a drug of choice with the Rajata Basma and Brahmi. Then Ashtamurti Rasayana and Palashakshara I use in lot of chronic cystitis cases, and specifically in young girls. This combination work like a nectar. Then Ashtamurti Rasayana also can be used in multiple means it's a in a multiple combination you can use, but only you need to choose the Anupana and other suitable combination. If you mix, Ashtamurti Rasayana can be a really good of choice. So Ashtamurti Rasayana is a combination of one part of Parada, 6 part of Gandhaka. Then there is a Shila, Malla, Tala, Rasakarpura, Then it is mixed with the Muddarashunga, Pitkari, Suvarnavarka, and Chandivarka. These are the things we mix in Rasam Ashtamurti Rasayana. So in I use it in STD, Apasmara, Mutragata, and musculoskeletal condition. Next. So the last one, the Vyadhyarana Rasa. Again, the Vyadhyarana Rasa, you get lot of combination. So again, the combinations are Parada, Gandhaka, Tala, Shila, Rasakarpura, and Malla. These are the combination in Vyadhyarana Rasa. So specifically, I use it in all STD related issues and blood related issues and Nadi Vrana cases and again Nasa Vrana. So these are the things what we use in Vyadhyarana Rasa. Most of the condition Vyadhyarana Rasa, I use it in lot of genital related infectious condition and also the untreated ulcers with a diabetes condition also Vyadhyarana Rasa is a drug of choice. Up to half to 2 rati can comfortably use it. So in nutshell about this is about all Sindura Kalpana usage in my clinical utility. The session is open for question.
Thank you so much, sir, for the amazing presentation. So in detail, you have come. Yeah, you gave a gist of Sindura preparations and its, indications and clinical indications. Especially because many Ayurvedic Vaidyas are hesitant or they have less knowledge regarding the Rasaushadhis. So it was a very enlightening session, sir. Thank you so much.
Yeah,
So
thank you.
the session, so now the participants can raise the hands one by one, and we will, we will guide you to the question and answer session. 1 second. So anybody has a query can raise their hand. Actually, I'm unable to see everybody at one screen. Meanwhile, we'll be taking from the chat box, sir.
Yeah, no issues, doctor. Please, you take a call. I am comfortable in any way.
Okay. Science. Okay, fine. PPT. I think PPT you will be sharing, sir. Few of them are asking. PPT,
Yeah, no issue. No issue. I will send it because I am not accessible to the PPT now. So
sure,
once tomorrow I am in office, I will share it.
Okay. So I will take the first question. Dr. Swati is asking that. Okay, Shakuntala madam herself has raised the hand. So, ma'am, you can go, ma'am. You can ask the question.
Madam, am I audible? Amula?
Yes, ma'am.
Yes. Sir, I have a question. Like you told Shila Sindura can be used in chronic constipation or when this intestine movement will be very less. I have a patient which is having a chronic constipation. She is around 38 years. And when this scan done, cystocele is there. So can we go? Can we go with this, sir? Shila Sindura along with what combination? They are suggesting for this star procedure of operation. They are asking for this Ayurvedic line of treatment.
See, particularly the cystocele is a condition, means it is a complication from the maybe if she had a complicated delivery or means also according to me when there is a cystocele, there should be involvement of the uterus also. Many times in the normal scan it doesn't pick up that easily. So there is a gynae issue also here. When this is what I cleared in the initial stage, when there is anatomically there is no abnormality. The cystocele condition is an anatomical deformity where it is pushing the anal canal and the rectum, and especially there will be a significant pressure on the rectum. Because of that, they will be undergoing this thing. Shila Sindura can be used. There is no harm in using, but I don't see any much of a relief from this. relief from the Shila Sindura usage. Here, you should treat it as a particularly hernia here. So drug of choice will be like maybe Hingu Trigonataila, then Sukumaraka Kashaya, these things, but nothing will permanently fix. Then, according to me, because
in that also they have given pelvic relaxation. Pelvic relaxation was noted like that. They have told maybe after the procedure operation they may suggest some physiotherapy. This is our surgeon's opinion. I have actually inquired. So when you are talking about this, no, so I thought of, because I am treating her for this constipation and other things in so many days. And again, one thing is clearing, another thing is like she is because of that cystosil, she is again and again getting this urine infection. This was we noted. That's why I'm asking.
No, doctor, correct. Till she goes for a surgery, maybe like the Suvarna Vanga, then Ashtamurti Rasayana is a drug of choice in her case. But at the end of the day, that cystosil has to be repaired, because you are telling she is 35. Otherwise, it will have a long-term impact on her life. So better she should use.
Okay. Thank you so much.
Thank you, doctor.
Dr. Shubhangi, can you please mute your... Dr. Shubhangi, kindly mute yourself. Mr. Rohit has, Dr. Rohit has raised his hand. So, sir, Dr. Rohit, you can ask the query.
I want to ask about the chronic sinusitis or Dushtapratisaya, and what about should be done in Vatapratisaya, because there are so many patients. I'm from Haryana, and there are so many patients from 20 years old to 60 years old. So many patients with loss of sneezing and water in nose. So what can we do in best Dushtapratisaya and Vatapratisaya sinusitis?
Okay, doctor, in the case of Dushtapratisaya, when there is a purulent discharge with a sneezing and all, the first drug of choice will be Shila Sindura. If it is a pure Vataja, there is no much of a discharge, it's only the sneezing, then particularly the Tala Sindura is the drug of choice. When there is a purulent discharge and thick discharge and with a sneezing and involvement of ear, then please go with the Shila Sindura. Again, you may need the bystanders like Dashamula Kadatraya or Vyagradi Kashaya. These are the drug of choice should be there, but the main drug can be Shila Sindura or Tala Sindura can be utilized. You will get really good changes, and once they recover, then you can reduce the dose, and you can to improvise, you can go with a kind of Dashmula Haritaki, mix this some amount of Sindura with the Dashmula Haritaki or Chitrak Haritaki, and you can give.
Sir, is there a role any Sadbindu Tel, Anutel, any food nashe? Can we do?
Definitely you can go with that. There is no problem at all. Even Ashtangaradaya, there is a reference of Shrungyadi Taila. The seasonal like the rhinitis and all those in those cases, this Shrungyadi will help a lot.
Okay, sir. Thank you, sir.
Thank you.
Thank you, sir. So we will take questions from the messages chat box. So Dr. Swati is asking, when many Rasaushidhis are Kafahara, how to decide where it is used? Okay, correct. So in this particular cases, Sindura, see, the Kafahara is a very, very broad term. So if it is specifically, if you are coming to me with particularly the chest related issues, where let's talk about sputum. So if am I right to interpret this question as a Kafahara? Should I interpret with a respiratory infection related, or in general Vata Kafahara?
No, sir, respiratory.
Respiratory, okay, fine. So specifically the Shila, the Manashila is a Kapha Samshoshaka, where there is a purulent discharge and where there is a continuous discharge of the sputum. In bronchiectasis, bronchialectasis and COPD cases, Shila is the choice, where there is a lot of mucus production in a thick manner. Then there is one need to use the Shila. When Tala comes, it is Kapha Samshoshaka. So it is specifically in trachobronchitis, in general bronchitis cases, in a dry cough. In general, in terms of raw terminology, you can go as a particularly only in dry cough related issues, you can use Tala. So that way you can differentiate in between Tala and Shila. But when it comes to particularly Samirapanagarasa, a mixed presentation. Initially, there is a discharge of yellowish sputum, greenish sputum, and afterwards, after 2 to 3 cough, I am getting clearer, and still I will have my whitish secretion. There you can use as a Samirapanagarasa because it is a much a lighter version of this Tala and Shila directly. So there you can mix the presentation. You can use Samirapanagarasa. Hope that my your question is answered, doctor. If any doubt, please ask me.
No, sir, it's very clear.
So next, Dr. Vinyasa is asking that for CKD patients, which Sindura should be used?
No, see, in treating CKD, till my clinical practice, I am not interpreting anyone else. In my clinical practice, Sindura's usage in CKD, I never done directly. Never done. Only the complication of CKD maintenance, I may given in for 3 to 4 days or maximum 5 days, but I never used any Sindura in directly treating CKD. I don't have experience. But nephrotic syndrome, microalbuminuria, all those things I treated, but not definitely CKD directly.
Okay, thank you, sir. Then Dr. Shubhangi is asking, sir, could you please repeat the usage of Purna Chandrodaya in triple vessel disease?
So I make always one particular combination and I keep, that is the Purna Chandrodaya. One second, I'll just anyway. So Purna Chandrodaya Rasa, Tamra Bhasma, Tala Sindura, and Pushkar Mula Churna. It is my standard combination will be kept, especially it is to the triple vessel or double vessel disease related with a dyspnea. Whenever the patient comes with a dyspnea complaint with a triple vessel disease, this combination as a base medicine we give.
Okay, sir. Dr. Induja is asking a case in which a 55-year-old male complains of chronic cough and kapha only. Only high ESR levels are seen in the report. All other parameters are normal. Kindly guide the line of treatment. And also she says, wonderful presentation. Thank you so much for your experience, clinical experience.
No, that information is too less, Dr. K. I need some more information because if it is a chronic cough and a raised CR, the ESR, then we may need to go with a maybe chest CT or anything to furthermore evaluate. And if there is a the weight loss and all those things, we need to rule out tuberculosis. So means whether patient is COPD or asthma, all these things has to be differentiated. So what are the symptoms going on? If you can tell, then I can come up with some combination. But we need to rule out if it is a chronic case already.
Yeah, namaste, sir. He has taken treatment for asthma long back, 5-6 years back. After which, as of now, he has only, he stays in Bangalore. So when there is weather change, he coughs a lot. And Montelukast tablet or other few tablets he take it for temporary relief. And recently he took the report. He was taking Ayurvedic medicines, Talisati Churnam, Sudarshan Churnam tablet. With that he got some relief with the Amrutarishtam, Dashmalarishtam. Recently, 1 month back, he took the report and he shared that only the ESR levels are high and all other parameters were normal.
No, is there any weight loss?
No, sir, no weight loss, sir. And no BP, sugar and anything.
Okay, and always the chest is clear?
Chest is not always, sir. Sometimes it is full of kapha and he keeps coughing and spitting it out.
No, what will be the color of sputum?
He has said whitish or similar to that, sir. Not too green or yellow and all. He has always said it's very thick and white.
Okay, so then you can, in this kind of condition, normally even if you don't want to give, you don't want to sit and do the combination, even tablet like the Shwasakalpa, Shwasakutar Rasa with Vyagradi Kashaya or nowadays this Shwasamrita syrup, it will really do good. But if you want to sit and do the combination, then you should choose in this kind of condition, Tala Sindura, little bit of Suvarnavanga. Then along with that, any Kafasravi drugs you can mix, like the Somalata, then Dashmula Traya, these things you can give. Definitely they will improve, and especially if it is a seasonal changes, then afterwards you should move on to Dashmula Haritaki or Chitraka Haritaki.
All right, sir. But he kept asking why only ESR levels are so high, like triple B.
Yeah, so there you need to furthermore dig the case, doctor, because how much is the ESR?
4,000, sir. Something close to.
ESR is 4,000.
Yes, sir.
Yes, sir. If you see, if it is a ESR 4,000, I think immediately you have to run the test for the tuberculosis, specifically gold test. If the acid fast bacillus, if it is coming negative also, you need to investigate on gold test, gold standard interference test for the tuberculosis. Then you need to rule out immediately bronchial ectasis and honeycombing appearance and go for a chest CT immediately. 4,000 is quite high.
All right, sir. Sure. Next time when he comes up, I will rule out this and advise him to go for this further test.
You're talking about WBC or ESR? ESR is quite high. Okay, 4,000.
Yes, sir. Only that was high. Everything other things were normal.
No,
so
I think, see, first of all, you need to send it for a ESR repeat. You should send it for ESR repetition. I don't think it is 4,000.
All right.
Yeah.
And what TB test that you said, sir, to rule out? What was the test?
It is called as the gold test.
All right, sir.
Yeah, I think according to me, report should be wrong, doctor. ESR is just impossible. 4,000.
Check for another repeat and then I will.
Yes.
Thank
you. Thank you, sir.
Thank you.
Dr. Vinyasa is asking, in ILD, which combination is good in Sindura Kalpas?
Yeah, so then the first drug of choice will be Tala and Shila, both can be used, and more than that, Ashtamurti Rasayana is can be used in ILD, and gold, the Suvarna Bhasma, more than Sindura, Suvarna Bhasma will go really well. The Tala and Shila combinations are really go with that, and Tamra Sindura. These three is the drug of choice in ILD. But just these three are not sufficient. You need to go with some other thing, like ILD is a mixed representation of so many things. As a base medicine, you can go for these things: Swarna, Shila, and Tala. These three.
Thank you, sir. Dr. Praveen Gowda is asking, can you tell me how to prepare Swarna Vanga Kshara and method of using it in Charmakila?
No. In Charmakila, just Suvarna Vanga and any Kshara. You take any Kshara. Specifically, I use Apamarga Kshara or Kadali Kshara. I mix and I apply it. There is no preparation of Suvarna Vanga to turn into a Kshara. That is the Suvarna Vanga Kshara. Just with the Suvarna Vanga, we prepared with some Siddha Vaidya. But in Charmakila, you just mix Suvarna Vanga and any Kshara. Whatever Kshara is available, and I used Kadali and Apamarga.
Okay, thank you, sir. Dr. Archana Joshi is asking, what is the treatment of Shushka Pratishyaya, where there is no sneezing, no cough, no DNS, no polyp, only nasal block?
So, no, again, we need to differentiate turbinate hypertrophy, and also we need to look into the nasal polyp. These are the clinically we need to differentiate. If there is a anatomical deformity like turbinate hypertrophy and polyps, so then this is surgical the intervention. But again, till if it is a very mild form, then particularly the Shila Sindura will help. Shila Sindura with particularly combination of Agradi Kashaya. Otherwise, one can go with particularly which one is that? One more Kashaya is there. I'm not getting the name immediately. So these things can be used, but if there is no symptom at all, like no sneezing, no discharge, no DNS, if it is only nasal congestion, then we need to send for the patient for the CTPNS, and we need to rule out specially, the endoscopy you need to do and try to look for turbinate hypertrophy. Turbinate hypertrophy in milder case, Shila Sindura will help a lot. Along with Kanchanara Gugula and all those things, if you can give it, it will work.
Thank you, sir. Dr. Ragini is asking, in children, especially in relation to respiratory system, nose congestion, what is the drug of choice in case of nose congestion?
See, if it is if it is a nasal congestion due to just the mucus, then as I told, if it is a clear discharge, then Tala, and if it is a very thick and purulent discharge, then Shila. But be careful when you use Malla. Malla can be a bit drastic. Tala and Shila is the first choice. It can be used in a lot of the pediatric cases, and especially if you're suspecting adenoids. As I was telling, in the pediatric cases nowadays, especially in the Bangalore region, adenoids are the one of the major culprit which causes, whenever you find there is a adenoid, tonsils, continuously ongoing inflammatory changes are there, never get hesitate to check the X-ray for the nasopharynx. If the adenoid is hypertrophied, Shila is the direct choice. Along with that, Gandamala Kandana or Kanchanara Gugulu, these are the combination, but Shila will be the base medicine.
Okay. Sir, she is also asking another question. In case of productive cough, which is the drug of choice?
No, productive cough, as I told, Shila Malla is the drug of choice initially. And with a yellowish sputum is there and thick sputum is there, for a few days you can run with the Shila, then you can switch over to Tala.
Okay, sir. Dr. Vijay Lakshmi has a question. In microalbuminuria, what should be the prescription? Low uric creatinine. Maybe low urea creatinine. I didn't get her. It's mentioned as low urine creatinine.
Yeah. There is a possibility of low urea and creatinine. I got it. It is a complex situation where there is a liver involvement as well. You need to rule out exact cause for the the particular patient will be on a metabolic syndrome, complex metabolic syndrome. You need to rule out. For a few days, you can the combination of Nagakesara, combination of Agnimanta, and along with the Suvarnavanga can be used in certain cases if the patient is non-diabetic. If the patient is diabetic, mild combination of Tala Sindura can be used, but Tala Sindura should be used very limited, maybe for 7 days and all those things for a symptomatic relief, and especially in nephrotic syndrome, Tala Sindura can be used up to 10 to 15 days till the patient feels better. Specifically with the nephrotic syndrome, patient will come to you with steroids. In the tapering of the steroids, this Tala Sindura will help there. Tala Sindura better to use with Ashta Sanskarita Parada. Then there is no much complication in usage of Tala Sindura for up to 15 to 20 days.
Okay, sir. Dr. Usha Ulla is asking, for how long resources can be given?
It's for me, it's a very question, but I love answering, but I keep giving in many means years together, not like there are patients who is taking from last 5 years also, but whenever you are giving for a long term, always try to follow the mandala concept. After one mandala, give a gap of 5 days or 7 days, then restart the medication. Then after the one mandala, you try to give some kind of Nitya Virechana, like with Avipati Churna and all. Then you start back. If you have doubt. And initial stages, I checked many people urea, creatinine, and means the entire KFT profile. 6 months, 1 year, we never came across any complication. And also I make sure, as I told, in kidney cases, especially giving mercury, I have not done the daring for long term. So only for 10 to 15 days I given. So I don't have experience in that particular area for a kidney patient giving Parada. Apart from that, in all cases, you can comfortably give years together. Nothing will happen.
Yes, thank you, sir. And Dr. Archana madam is asking, if patient is already on ATT and wishes to have some Ayurvedic medicines to overcome complications or to have some strength, so any options under Sindura Kalpana?
What is ATT?
Anti-tubercular.
Oh, okay. Anti-tuberculosis. Okay. So the specifically there, based on the symptom, you have to go. If you are going by the rule of base medicine, then Suvarnavanga as well as Shila Sindura is drug of choice with the Swarna Sindura. Otherwise, you need to treat the symptom. For example, with anti-tuberculosis drug, with they are developing digestive related issues, or they are losing the, in spite of the infection is coming under control, they are having a weight loss and all those things, then you can go with the specifically Rasasindura combination with the Vasavaleha and all those things. They are developing dry cough with drug therapy. Then Rasasindura Vasavaleha is the best combination to prevent the furthermore Kshaya. So that way, and Swarna Sindura can be given throughout their entire till they get better. Swarna Sindura is a drug of choice in all tuberculosis cases with to gain the strength. If you're talking, then go with the Purna Chandrodaya Rasa or Swarna Sindura. That is the combination. Purna Chandrodaya Rasa as a balle you can give. It acts as a balle in Rasayana.
Okay, thank you, sir. And meanwhile, Dr. Induja ma'am, you had question, no? So few other doctors have given their inputs. You can please go through the chat box regarding the ESR and other things. Going forward with the next question, sir, what can we do better in autism child other than Brahmi, Shankapushpi and other Medhya Rasayana?
See, the ultimately go. If you're talking only on the basis of improving the milestones, definitely without gold we can't act much in this case more than Suvarna Sindura. In this kind of cases, Suvarna Bhasma is a drug of choice, and also the what kind of issues we are addressing in autism cases with the spectrum. It is a broad spectrum condition where just as a Medhya, again, everyone knows ultimately it is the gold. Then you have you have Vacha and all those things already you repeated. I don't want to keep repeating. If it comes to the Rasayanartha, only if it is a Medhya, ultimate drug choice is gold.
Okay, thank you, sir. Okay, Dr. Rohit is adding autism like hyperactive anger, maybe ADHD also he is mentioning, I suppose, sir.
Yes,
So
sir. Autism child symptoms having more active, hyperactive, sir.
Okay.
And yes, sir.
So even if it's too much hyperactive and if it is with a violent behavior, then Rajata Sindura is a drug of choice. If you're talking only on Sindura Kalpana, Rajata Sindura, you want combination of a drug in the sense maybe you can go with the Unmadagaj Kesari or Apasmara Kulantaka Rasa if only for a few days to control the violent behavior. On a longer term, you can mix Rajata Sindura with a combination of Mahapaishachika Grita, Mahakalyanaka Grita. You can give on a longer term.
Okay, sir. Thank you, sir.
Thank you.
Sir, few doctors are asking your contact number. Can it be shared, sir?
Yeah, please, doctor. No problem.
Okay. We will share the PPT and sir's contact number in the group. Okay. And Dr. Shubhangi is asking which brand do you prefer for Sindura Kalpana, sir?
Nowadays, I stopped sourcing it from outside. We are preparing our own. Basically, I am preparing in Rasendra Shala and also certain SINDURA, my own combination, I prepare it here in my own pharmacy. Maximum nowadays, I'm getting it from Hyderabad, Rasendra Shala. Dr. Ramkrishna last time who came. So I'm procuring it from there.
Okay, sir. In case if they want to buy.
Yeah, see, initially I used Doodh Papeshwar and Unja company I used and Virgo. These three companies I used to do initially, maybe about 4 or 5 years back. In the last 5 years, I am using our own SINDURA Kalpanas.
Okay, sir. Thank you. And Dr. Rohit is again asking, is there any precautions of Lavana Katu Rasa use during usage of these medicines?
See, it is also I'll say there is no Katu Rasa. Definitely, it can be reduced, but Lavana Rasa is not a choice. But always I tell less, the less salty and all those things. There is a unless and until it is a disease specific with the Sinduras, I won't restrict much about Lavana intake. Means again, the same time I won't ask them to eat more or anything. The less, always my code goes with a clinical practice, like less spicy, less khara, like that. I keep telling the people. Otherwise, I didn't find much any major difference with changing it.
Okay, sir. Dr. Veena is asking, what is the line of treatment in hyperthyroidism, TSH being 0.0050 with nodules in thyroid? Patient has bulging eyes with fat deposition in eye muscles.
See, it is the first of all case looks like look to me thyroid toxicity. You need to differentiate the 100% goiter disease. The Graves disease you need to differentiate. If it is definitely hyperthyroidism, already told, it looks like a severe goiter disease. There, the first direct choice is you need to go with the Tamra. Without Tamra, nothing will happen in this condition. Tamra and Vishagarbha. Tamra and Vishagarbha is a direct drug of choice, and you need to act very, means loaded dose you have to give. And if the nodules are nodules, still there is a vascularity, then Vishagarbha Potali is a drug of choice, Tamra Garbha, and also you can add on Rajata in this kind of a cases. The Sindura Kalpana will be very it may not be the sufficient. You need to go with the Potali Kalpana or Bhasma Kalpana in this kind of a condition. You need to literally attack on the condition. If the vascularity is high, act fast. Otherwise, the condition may get worsen. And if they need, this is a case where they go with the radioactive isotopes. So you can control the condition, but here I don't think Sindura Kalpanas are sufficient. You need to go with the Potali or Bhasma Kalpana.
Okay, sir. Dr. Srinivas is asking, in a few cases, by using Tala Sindura or Rasamanikya, patients complained about blackish discoloration of hands. Once he discontinued, that discoloration got cleared. Is the problem caused due to poor quality of medicines?
Yes, there specifically in certain Rasamanikya preparation, if they're used, means particularly the choice of specifically in Tala, it may not be the Tala purification may be an issue. It happens. Even few people they came to me with blackish discoloration about 7 to 8 years back. There I didn't do much of research, but I found it is a more of a purification with the Tala is not done it properly. So even we changed the medication and they got better. I too came across. So it is the purification issue. So it is not purified properly.
Okay, sir. Dr. Usha madam is asking, any patya during Rasaushadhi Sevana Kala?
Normally, I avoid all raw food. I will ask them to improvise the absorption, completely cooked food. And the second thing, I will ask them specifically new tamarind, not to use too much of tamarind. tamarind. And another thing is I'll ask them more than anything, the time bound, like the early dinner, proper the timings, the food timings. I'll ask them to follow it, and the cold food, like specifically refrigerated items and all those things, because directly we are dealing with the parada. If they are going to take refrigerated food, cold items, the absorption may not be the appropriate. So that's how always I ask them cooked food and warm food to take, and less spicy. That is with that particular tagline I go. But in disease wise, yes, I have a lot of choice in telling. But Rasaushadhis in general, these are my reservation.
Okay, sir. Line of treatment for Hashimoto's disease.
So the Hashimoto's, again, see, the hyper and hypo, there is no much of a difference in treating. When it comes to Hashimoto's, there is a lot of different symptomology will be there. Like, if the patient is having particularly the anti-TPO and anti-TG is very high, and they have a lot of different symptomology. But base medicine, if you are asking me a base medicine, then Tamra, Abraka, then purified sulfur is a drug of choice in particularly the Hashimoto's condition. Tamra, Abraka. Abraka, Sahasraputi, Tamra Bhasma you can use, and also Somanati Tamra will do wonder in this kind of condition. Hashimoto's, it's a base medicine. But if you come up with a particular symptomology, then we can design the specific the combination for the particular symptom. The Hashimoto's comes with a lot of presentation. We need to be symptomatic based treatment also essential in this.
Okay. Thank you, sir. That was question from Dr. Hemalata ma'am. And next, Dr. Uday sir is asking, in this Taulia, which are the medicines you prescribe, sir?
So directly, if it is without any metabolic involvement, like without any hypothyroidism and this thing, normally nowadays I stopped giving them a medication. To be frank, so again, without exercise and without correcting a diet, we can't do anything. But again, common drug of choice, maybe for a few days you can go with the Varanadi, then Medohara Guggulu, Navaka Guggulu, then Arogyavardhini Vati. Particularly one single the one single Sindura or anything I never gave. It is a multi. There are multiple things are involved in obesity. So without any involvement, these are but mainly I believe in exercise and exercise rather than just give the medication and try to achieve the weight loss.
Thank you, sir. Any more questions from the participants? Because just few more minutes left. So if anybody has any query, okay, Dr. Srinivas wants to ask something. So you can ask.
Sir, regarding Namaste, sir.
Namaste.
Sir, regarding Graves' disease and all, like you said that Tamra and Vishagarbha Potali. So how does it act, sir? Like how does it act, sir?
No, directly Vishagarbha Potali and Tamaragarbha Potali, it directly checks the blood supply to the nodule and it reduces the vascularity. As soon as the vascularity is reduced, nodule size it will become stable. Then even in many cases you can see the differences in the nodule formation, and also it balances the particularly it helps in even in the Hashimoto's condition, TRAS and particularly the TSI. These are the antibody tests what we run. Even those things also you will see. For example, with the hyperthyroidism related tachycardia is there. Combination of Abrakabhasma, just for example, Nagarjuna Brasa is more than sufficient to treat the tachycardia. So like that, particularly these things, and being considering the thyroid with a combination, the Udaka Vasrutas concept, the Rajata is also will help in considering, because Rajata is it helps in regulating the lymph circulation and all those things. By that, the combination of Rajata, Tamra, Rajata and these things will help to regulate the thyroid. But whereas Vishagarbha directly it helps in preventing the furthermore growth of the nodules and all those things.
Thank you, sir. Thank you.
Thank you.
Sir, hello, sir.
Yeah, tell me, doctor, please.
I want to ask about the varicose veins in Ayurveda, from which we can correlate it and how can we cure it?
See the
Varicose veins.
see the correlation. You can go with the Siraja Granthi, Siraja Vrana, and all those things. But the drug, the drug of choice, the combination, like the nowadays with the from Alaknanda pharmacy, those hello.
Yes, sir.
Yeah, so from Alaknanda pharmacy, what Cardorium Plus is there, then Arborium Plus is there, those things as a Anupana. So then main drug of choice when it comes, doctor. So normally in
Dr. Ambaji, please mute yourself.
So when it comes to vascularity, in any vascular disorder, in specifically to treat and to prevent the furthermore complication like DVT, thrombophlebitis and all those things, Thala is the first line of choice. Thala Sindura can be used in treating all these conditions. Thala Sindura can be there. Apart from that, the regular these kashayas like even Sahasradi kashaya is more than sufficient to treat varicose vein. Then based on even with the varicose vein, when you find there is a lot of perforators in this thing, then Vranopani Rasa, these are the drug of choice you can go with, go doctor. But see, there is nothing like that you can reverse the condition or anything.
Yes,
treatment and management condition. And again, see, anything, this kind of vascularity is there, vascular issues are there,
yes.
Regular exercises, then changing lifestyle, like not to sit more time, stand for more than time. These things are mandatory.
Okay, sir. Okay. Thank you.
Thank you.
Sir, in one case of pneumonia, hello, sir.
Yeah, tell me, sir.
There was one case of pneumonia. She was having this Klebsiella infection on doing bronchoscopy. So she was having severe fatigue. Then so we have advised her this Swarnavasant Malini Basma along with Amrita Sattva. So this dosage she has been taking for 6 months. So there is some improvement in fatigue and all, and there was and hemoptysis also was there, which has come under control. So how long can she continue this Swarna Vasanta Malini Rasa? For 6 months she has taken.
Swarna
She should
Vasanta
give.
Malini.
Swarna Vasanta Malini.
Yeah, no, Swarna Vasanta Malini years together I give. So
no problem.
If you want, you can change the comp. According to me, if the preparations are good, nothing will happen. If you want to make sure, just do the kidney function test and see if the kidney parameters are fine. You just go ahead and use it. I never find, because it is Rasayanartha. Rasayanartha, whenever we are using, there is no issue. But to make the with the concept of Mandala and Satmya, you can give a gap of 3 to 5 days and you can reuse it. Otherwise, change the combination.
Okay, sir. Which one may be the better combination for next choice, sir?
No, in detail, to be more precise, I need more details. But again, here you can use the Purna Chandrodaya Rasa. Then combination in this kind of combination, this thing even if there is no much of a symptoms, then even if you want more Rasayana, only want to act on the fatigue and all those things, Nagarjuna Rasa is a choice. Then specifically the Mruganka Rasa is there. So these are the Rasayanartha. There are a lot of drugs. You can use these things.
So as a combination, can I give Purna Chandrodaya and this Mruganka Rasa and all as a combination, or as a single drug?
Even see, depend upon the based on the fatigue. So even Purna Chandrodaya and Nagarjuna combination is good. Then even Arogya Vardhini Shunga Basma you can give. So the Mruganka you can give as a single drug alone.
Okay, sir. Thank you.
Thank you.
Sir, Namaste, sir. Okay. Can you hear me? Namaste, sir.
Yeah. Yes.
Yeah. I was the one who asked about that hyperthyroidism case, sir. So you said Tambra Garbhapotali and Visha Garbhapotali, both I have to give, and what is the dosage, sir?
No, again, you can start with 30 mg, 30 rounds. but 30 mg, 30 rounds may not be sufficient, and based on the patient weight and all those things and how they tolerate, easily according to me up to 60 to one particular dose, up to 60 rounds easily you can go. Tamragarbha, Vishagarbha, start with the 15 rounds and easily go up to 45 rounds.
Okay, so this is per day dose, no, sir?
No, single dose. Single dose. Single.
Sir, okay.
In a day 2 times easily you should give, doctor. Otherwise, disease cannot be controlled.
Okay, sir. And what further investigation should I ask her to do, sir?
No. If it is a well-established hyperthyroidism and Graves' disease, you need to rule out the Graves' disease and thyroid toxicity. There you need to do anti-TPO, TG. Then there is some test called as TSI test. Then there is a TRA-IS test are there. These are all antibody tests. You should run the antibody test first, then also the thyroid scan.
Okay, sir. Okay, sir. Oh, and these two are enough, sir, or should I add any other medicines for this?
No.
She has got a little bit of tachycardia, but it is under control now.
No, if the tachycardia is there, based on how bad it is, even you may need to give, for example, Nagarjuna Prasa if it is in the mild form. If it is very, very high, then you may add on Dashmula Kashaya with Bharatvata Chintamani. See, the side-by-side symptomatic treatments are very different. For example, if the patient is having a lot of hot flushes and all, then you may need to give Kamaduda Rasa and Pravada Pishti. So, it is a symptomatic treatment is one side, doctor. One side you need to treat base. To treat the base condition, Tamra, Shila, Tala, or Visha, these are the drug of choice initially.
Okay, sir. Okay,
for example, uncontrollable hunger is there. Then you may need to give the Dashmula Rasayana or Datri Loha, these things. So it is, you need to act depend upon the symptoms.
Okay, sir. This patient has got only no other symptoms other than little tachycardia, sir.
So
other than that, symptomatically she doesn't have any this thing.
Weight loss?
No weight loss, sir.
So then you just keep giving for tachycardia like Prabhakaravati or Nagarjuna Brasa, whichever suits for her. And the base medication can be Tamragarbha and even Talagarbha is sufficient. And if the nodules are very prominent and there is a vascularity, then you should think of Vishagarbha.
Okay, sir. Sir, this treatment will go for 6 months or like that, sir. What will be the time?
Normally, at least you should give for 45 days to 2 months, then repeat all the tests and see the scan, and based on that, you need to keep changing the medicine, doctor. So yeah, means it cannot just blindly 6 months or 9 months. We should see and we should act upon the condition. We can alter the dose and all those things.
Okay, sir. Thank you so much, sir. Thank you very much.
Thank you. Thank you.
So just a couple of more questions from the chat box.
Yeah.
So in children, from which age we can start giving Rasaushadhis? Question asked by Dr. Suma.
Oh, so even for 4 days baby also I given Tamrabhasma. So normally even for easily we means even when you can start Suvarnabhasma early age, you can start at any age. So I don't think age should not be the problem to start. Only thing, if the preparations are good, just based on the bala of the means in the children, very little dose you can start.
Okay, thank you, sir. Dr. Vishwanath sir is asking, can we treat polycystic kidney disease? Do we have any scope with Rasaushadhis?
No, I haven't tried polycystic kidney diseases to treat with any Rasaushadhis. To the maximum I may use the Arogya Vardhinivati and all those things, but not directly as a single Rasaushadhi like Tamrabhasma, Suvarnamakshika Bhasma. You asked me, I never used in polycystic kidney disease, because as a polycystic kidney disease they present with a lot of issues. Like the many polycystic kidney patients, they will come to me when there is a creatinine is being affected and when urea is affected. So at that time our hands will be tied with so many restrictions. So I use Arogya and all those things, but more oftenly I go with the combinations of herbs only rather than long-term Rasaushadhis. And polycystic kidney disease, I didn't feel much of a change. Means maybe one or two cyst, there is a reduction, all these things, but I never reversed the polycystic kidney disease fully.
Oh, okay, sir. Thank you. And Dr. Asha is asking, in a case of bradycardia, that is with hypertension and ventricular hypertrophy, how to go about it, sir?
So the Malla is the drug of choice. Malla Pushpa, all those things you can give. Then you can also give Brahat Utta Chintamani. It will help. In emergency condition, you should have Malla Pushpa and all those things. The Malla combinations as a Hriday Uttejaka, it will help to improve the particularly heart rate. Hello. Hello.
Hello.
Yeah.
Sir, that is it. I think it's all. If,
Sir, namaste. Sorry, sir.
Time and it's.
Sir?
I think Dr. Srinivas has one more question.
Sir, can we avoid AKT in tuberculosis patients?
No, till the date, only one case which I handled because the AFB was coming negative. The gold test came positive. The load was high. There I treated without any ATT, but case was not disclosed to the government. But when you start to treat tuberculosis without government involvement, nowadays there is a strict regulation. But definitely we can treat. I'm not saying no to it, but there will be a medical legal issue.
Okay, okay. Thank you, sir.
Thank you.
Sir, namaste, sir. Actually, in one case, thyroid biopsy was done. If it comes like grade 1, grade 2, how should we treat it, sir?
No, it's grade 1, grade 2. I didn't understand.
Sir, thyroid biopsy was done, sir. She was hypothyroidism. So, but they said TSH level is within 10 only, sir, like 4, 8, 6 it is there. When biopsy was done, they went under like grade 1, grade 2. But the report gave Hashimoto's, sir. But what should be next was grade 1, grade 2, Graves' disease and all those things. So
what
how
is
should we take
no,
that?
it was a grade 1, the means you are talking about the nodules grading, or you are talking about disease grading. So you
biopsy grading.
No, biopsy grading for grade 1 related to the grading was related to what, doctor? I am not
Thyroid, sir.
No. Can you share me the reports, doctor? I want to go through. Then I will be
Yes,
able to
okay,
answer.
sir. I'll discuss with you, sir.
Yeah. Okay.
Okay, sir. Thank you, sir. Okay, sir.
Dr. Sudha, you want to ask any question? Or you can, if you don't have any question, kindly mute yourself. I think that's all for the day, sir. Anybody? Last one chance. Anybody wants to ask any question?
Madam, please share the first number, madam.
Sure, madam. In the group, we will share it, madam. And Dr. Jyoti has a query. Before that, Dr. Induja, madam, had a query, wherein she had mentioned ESR is 4,000. Now she has clarified it is eosinophil count. Okay. And Dr. Jyoti has a question. What should be given in a boy of 26 years who has hyper IgE around 4,000 with chronic rhinitis?
Okay. See, the Ig levels when it is around 4,000, so definitely it mimics this thing. This boy, either he may go for a allergic bronchitis or allergic atopic dermatitis or eczema. There is a high chance these people, when they are in a high IgE, there is a sequelae is present. In this kind of a condition, if it is only rhinitis, then even Shwaskutara, Shwasakalpa is sufficient. Then Dashmula Kadatradi Kashaya, Vagradi Kashaya, Dashmula Haritaki. See, you can see why I am telling you this combination. You need to run through with the person and how they respond with this medication. You can always try to come to the baseline. Even sometimes they may go very well with Haridra Karna only, but high IgE will come down. In a Bangalore climate condition, I never saw if somebody is on more than 1000, below 300 or 400, I never saw them reaching it. In a rare occasion it happens, but symptomatically they will start to feel better within 45 days to 60 days. You need to run the medicines for a long run.
Okay, thank you, sir. Last, any question? Okay, I guess.
How do you treat Madhumeha, sir? How do you approach and how do you?
See, the Madhumeha, my either type 1 or type 2, my both in both the condition, my choice is like, you know, the first is Tamra, definitely. Then next is my drug of choice are Abraka. Then apart from that, from the Trivanga Bhasma, these are the drug of choice. So based on then again, I may mix with Nisha, Amlaki, Churna, or go with Kathak Kadradi Kasha and all those things. And it is a challenging. It is not every patient respond in a appropriate way. But normally, even I have more than 100 patients who is only on Ayurveda medication. We keep using Aragyavardhini, Chandraprabha, Gokshuradi Gugulu. So these things, and then when there is a lot of issues, I may go with Suvarna Basanta, Vasant Kusmakar Ras. But now we are using a lot of Tridhatu Garpapotali, we are using Tamra Garpapotali, we are using like, you know, the Vishagarpapotali in a low doses, we are using in a lot of cases. They respond good. I won't say absolutely we have 100% good track record, but good amount of success rate is there. With exercise and food, they respond very well.
Sir, in diabetic retinopathy and nephropathy, all pathies, diabetic pathies, sir, can you just highlight, sir? Sorry.
See, the diabetic neuropathy, drug of choice is Suvarna Basanta Malti, then Vasant Kusmakar Ras, then Rasaraj Rasa for a neuropathic related issue. Again, if it is a demyelination is there, then you need to struggle hard to treat it. Retinopathy, definitely yes. The Yogendras, Hemagarpotli is the drug of choice. Along with that, you can mix Saptamurta, Tapadi. Then also here Panchakarma treatment are really essential. Without Panchakarma treatment, results are not this thing. You can go with a Tarpana, then Nasya. Vastis are the main choice of drug here. More than any medicine, Vasti Virechana is the main theme. What you need to do. Sure, the purification is very important in this kind of cases.
Thank you so much. Thank you all the participants for such an interactive question and answer session. So it was a wonderful session indeed. So now I would request Dr. Archana Madam to present a vote of thanks.
Namaste. Am I audible, ma'am?
Yes, madam.
Yeah. Namaste and a warm good evening to all. It's a quote from Arthashastra which tells Shushrusha Shravana Grahana Dharana Vijnanoha Poha Tattva Bhinivesha Prajna Gunaha. That is, there are 6 qualities for an intellect. That is, desire to learn, listening, perception, retention, elimination of doubt, and determination to know the truth. And this is the second time we are meeting sir, and I could see that all these 6 qualities are so well imbibed in him that in the last session when we had with sir, he was requesting if there are any more good treatment which I can do in certain of his cases. Being himself expertise, he was seeking for experience from others also. So that is the humbleness we could see in sir, and where there is humbleness, Dhanvantari would really bless. So, and that also we could see, sir. So it was a wonderful presentation which was very clear and precise, with full of experience and confidence. And these 2 classes, what we had offline and today's online class, it has really boosted our confidence. Thank you for giving us such confidence and information, sir. Thank you very much.
Yeah. Thank you, Doctor. Thank you.
Yeah. And also, I thank all of our admins team who have worked behind and on the screen, and all the delegates for being patient, and hope to have such a presence, like full presence till 5 o'clock, and asking questions, because without you the presentation won't really will have its worth. So thank you for being here. Hope to see you in the next sessions also, and have a great day.
Thank you so much, Archana Madam. Once again, on behalf of RAAUOS team, I thank you, Dr. Satish Ranjanagi sir. Like already Archana Madam said, both the sessions we have witnessed your talk and the knowledge, the expertise you have, and also the humbleness to even learn, because medical science is one such thing. It is a never-ending learning. So it inspires us, and also the knowledge of Rasaushadhi's application, it motivates us for sure. Thank you so much, sir. Once again, we would want you to give another presentation on another important topic very soon. We really had a very knowledgeable time with you, sir. Thank you so much. And thanks everyone, all the participants and the admins team. Thank you so much.
Yeah. Thank you, Doctor. Thanks for the opportunity. Thank you.
Thank you, sir.
Thank you, Satish Ranjanagi, sir. Really, it was
Thank you, ma'am.
wonderful.
Thank you.
It's a different, how we are applied in different aspect is just amazing. Just I am listening all the way. Very nice.
Thank you, Doctor.
Thank you.
Thank you. Thanks for that.
Dilip sir, you can stop recording. Dilip sir, please stop recording, sir. I request admin team to be on a video. Take a one photo. Dilip sir, please stop the recording. Admin's team be on video. Archana ma'am, Amulya.